Good morning, everyone. I'm very happy to have the chance to talk about my PhD work, which is the role of various physiotherapy modalities in the treatment of pelvic pain syndromes. My name is Gökçe, and I'm a full-time PhD student at Semmelweis University. And I believe pelvic pain will be alleviated with the knowledge of advanced physiotherapy methods. And I aim to enhance the quality of physiotherapy treatments for patients, resulting in better patient outcomes and overall well-being. Currently, we have two ongoing projects. Both of them are systematic reviews and meta-analysis, and you will be hearing more in detail in the following minutes. The title of my first project is Investigating the Effectiveness of Physiotherapy Methods in Women with Endometriosis-Associated Pelvic Pain. Endometriosis affects 10 to 15% of all women of reproductive ages, and unfortunately that means more than 190 million women. The infertility and/or pelvic pain ratio among these women is as high as 35 to 50%. And physiotherapy techniques might be efficient in the treatment of endometriosis by reducing inflammation, relieving pain, and improving quality of life. However, physiotherapy is poorly utilized in endometriosis treatment and research, which leads to lack of guidelines, impaired patients' potential improvement, and higher costs. There are various physiotherapy techniques that we can use to help these women, and I created 5 subgroups in order to indicate them in a better way, which are exercise, activity, physiotherapy agents, manual therapy techniques, hydrotherapy, physical therapy equipments such as dry needling and Graston tools. And our aim is to investigate the effect of physiotherapy methods in relieving endometriosis-associated pain. Accordingly, we wonder, do diverse physiotherapeutic interventions exhibit differential efficacy in improving pelvic pain in patients with endometriosis? And we choose women with endometriosis-associated pelvic pain as our population, with the intervention of various physiotherapy techniques, and we would like to compare these techniques. And our outcome is pelvic pain reduction with the different pain measurement scales, such as visual analog scale. And our hypothesis is various physiotherapy techniques might have different efficacy levels in reducing pelvic pain related to endometriosis. And our research implication is to apply the most effective physiotherapeutic approach in reducing endometriosis-associated pain. We conduct our systematic search in 3 major databases, and our search key have 2 domains. The first one is our population, and the second one is our intervention group. As a result, we had almost 10,000 citations. After the duplicate removal and title and abstract selection, we had 15 eligible full texts, but the number might change as we try to retrieve more articles. Currently, we are trying to finalize our full text selections, and we also had begun our data extraction, 5 of them already done, and we plan to finalize it in the following days. And after talking briefly about my first project, I would like to draw your attention to my second title, Investigating the Effectiveness of Physiotherapy Methods in Women with Menstruation Pain. Menstruation pain, dysmenorrhea, affects 50 to 90% of women worldwide. And 29% of these women experience severe pain, and this heavily impacts these women's quality of life, productivity, and focusing ability, and absence from work. If you look at the figure 1, you will see that in a study, 68% of participants report absence from work or school about their pain for about 1 to 5 days. And currently, usual care is mostly focused on pharmacotherapy with the prescription of NSAIDs, such as ibuprofen or Celebrex. However, these medicines have some side effects from headache to cardiovascular diseases. And they have some contraindications, like kidney diseases, stomach ulcers, and they cost between $12 to $125 per month. Accordingly, there is a need to explore innovative and effective treatments. And physiotherapy modalities are excellent therapeutic additions and/or alternatives to standard care, as they are non-invasive, they are cost-effective, have low risk of side effects, help reducing pain intensity and duration, they have long-term benefits, and they help improving quality of life. The subgroups almost are the same. There are some few minor additions, and our aim is to assess the efficacy of physiotherapy intervention in reducing menstrual pain to improve women's quality of life. Our clinical question is, do different physiotherapeutic approaches have diverse efficacy in relieving menstruation pain? We choose our population as women with menstrual pain. Our intervention, again, various physiotherapy techniques with the comparison of the techniques, and our outcome is pelvic pain reduction once again. But for this study, we would like to include a study design. We only want to include randomized controlled trials. And our hypothesis is various physiotherapy techniques might have different efficacy levels in reducing menstruation pain. And our research implication, to apply the most effective physiotherapeutic approach in reducing menstruation pain. So we are in the early stage of this project, and it seems like this is a feasible topic, and we are eager to take steps forward and make more progress. In summary, we have currently 2 ongoing projects, and they are both systematic reviews and meta-analysis, and we are planning to submit them by May and September on the following year. And before ending my presentation, I would like to leave you with one of my favorite quotes from Arthur C. Clarke. The only way to discover the limits of possible is to go beyond them into the impossible. Thank you for all your attention and your time.
Thank you, Gökçe, for a great presentation. I just had one question, whether you plan to do the subgroup analysis based on different kind of therapies and based on different age groups of women for the first study.
Mm-hmm. Well, thank you for your question. Accordingly, we will have too many subgroups, but we didn't finalize our statistic meetings yet, so they're not really clear in this stage. But I could tell that, yeah, we have to create some subgroup for ages, for different techniques, and also the treatment periods as well. And thank you again.
I'd like to ask, why did you choose to study physiotherapy in gynecology?
Thank you for your question. The reason behind choosing this topic is the gap in the literature, because as I mentioned, physiotherapy is poorly utilized both in research and the treatment of endometriosis or other gynecological diseases. And with my research, I would like to address this gap with the possible physiotherapy techniques.
I would like to ask, why did you conduct a meta-analysis, and do you plan future studies with another study type?
Mm-hmm. Thank you. Well, yes, I do plan to make any other study designs as well. First of all, I would like to see the most effective treatments options, so then I could choose these methods in my other research as a therapy methods. Thank you.
Thank you for the lovely presentation. So my question is, why did you only include RCTs in your second project but not in the first one?
Thank you. So, as I mentioned, there's a gap in the literature. So, in endometriosis, there were not enough RCTs, and I didn't want to restrict my project with low number of the citations. But in my second title, there are a lot of RCTs as well, so I thought maybe it would help to have a better quality of research, so I included them in my second project.
You mentioned a quite long list of techniques that can improve in your first study, the pelvic pain. Do you already use some of these in clinical practice, and can you mention some of it?
Thank you for your question. Well, currently I'm not working as a physiotherapist, so I don't have clinical practice at the moment, but yes, we can use many of them, especially heat and electrotherapy, most popular ones among them.
Thank you. Thank you.
Thank you.
My question is related to your second topic, and you mentioned some additional physiotherapy interventions which can be used in subgroups. And what are those, and why would you like to include them?
Yeah, thank you for your question. Actually, I was hoping to mention them during the presentation, but there were not enough time, so I couldn't. We included modalities mostly focused on the heat, such as warm water baths or heating modalities. And in some studies, it's indicated that heat can be helpful for the dysmenorrhea, but it's not really advised to use in endometriosis due to inflammation. So they are basically related to the heat modalities.
As far as I know, one of the physiotherapy methods to relieve pain is acupuncture by needle. If acupuncture will be included for your study or not?
Thank you. Well, we can't include that one, but there are many studies which included acupuncture, but it's mostly not a valid physiotherapy technique. So it's outside of our department and our files, so we didn't want to include this technique in our studies, and we wanted to focus only the available and valid physiotherapy techniques. But they are also effective as well.
Congratulations, Gökçe, on your nice presentation. My question is related to Lorenz. I know you said that you are not actually practicing currently. However, my question is, what is your opinion? What is the attitude of women towards physiotherapy instead of getting pills? Like, do they actually relate on this, or are they willing to do it instead of just getting a pill and relieving the pain? What is your opinion about this?
Thank you for your question. Well, first of all, I would like to mention that I'm not defending that from now on we will only focus on physiotherapy, but we can choose physiotherapy either over pharmacotherapy, or we could choose it as an addition. And if we look for the benefits of physiotherapy, there might be have chance to help population with the contraindications. So we could have this group and we could choose over physiotherapy in that case. And it has low risk of side effects, so it's also beneficial from that point. And it's cost effective if you cannot afford these pills, or some cases, some people just feel so depressed due to depending on these pills, especially if you're a younger female. And many of my friends actually give up their treatments due to this reason. So physiotherapy gives them to solve their problems by themselves and increase their self-esteem. And from these aspects, I think physiotherapy might be helpful. But of course, it depends on the case, the patients, and as well as the disease severity. And thank you.
Okay, my question is, what is your opinion about, this is the first topic, okay? What is your opinion about the role of the sexual partner in this disease? And would you see any reason to include this issue into your research keys?
Well, thank you for your question, first of all. We are not really focused on the other factors. We are focusing on the pain. So for sure, if we look from the life quality, from the psychological aspect, the role of their partners is very high. They have to be supportive. But as I mentioned, in my research area, I'm focused on the most specific treatment methods, so I haven't checked them yet, at least yet.